What is the primary cause of coronary artery disease? CAD. Option 1. Atherosclerosis. Option 2. Hypertension. Option 3. Diabetes. Option 4. Obesity. The answer is option 1. Atherosclerosis. Which symptom is most commonly associated with angina pectoris? Option 1. Shortness of breath. Option 2. Chest pain or discomfort. Option 3. Irregular heartbeat. Option 4. Dizziness. The answer is option 2. Chest pain or discomfort. Which type of angina occurs unpredictably and often at rest? Option 1. Stable angina. Option 2. Unstable angina. Option 3. Variant angina. Option 4. Microvascular angina. The answer is option 3. Variant angina. What is the main risk factor for developing CAD? Option 1. Smoking. Option 2. Physical inactivity. Option 3. High LDL cholesterol. Option 4. All of the above. The answer is option 4. All of the above. What does an elevated troponin level indicate? Option 1. Heart failure. Option 2. Myocardial infarction. Option 3. Stable angina. Option 4. Atrial fibrillation. The answer is option 2. Myocardial infarction. Which diagnostic test is considered the gold standard for diagnosing CAD? Option 1. Electrocardiogram, ECG. Option 2. Coronary angiography. Option 3. Echocardiogram. Option 4. Stress test. The answer is option 2. Coronary angiography. Which medication is commonly used to relieve angina symptoms? Option 1. Aspirin. Option 2. Beta blockers. Option 3. Nitroglycerin. Option 4. ACE inhibitors. The answer is option 3. Nitroglycerin. What lifestyle change is most effective in reducing CAD risk? Option 1. Quitting smoking. Option 2. Reducing sodium intake. Option 3. Increasing protein intake. Option 4. Using supplements. The answer is option 1. Quitting smoking. Which part of the heart is most commonly affected in CAD? Option 1. Left atrium. Option 2. Right atrium. Option 3. Coronary arteries. Option 4. Pericardium. The answer is option 3. Coronary arteries. What does ST segment elevation on an ECG suggest? Option 1. Stable angina. Option 2. Unstable angina. Option 3. Myocardial infarction. Option 4. Heart failure. The answer is option 3. Myocardial infarction. Which of the following is a modifiable risk factor for CAD? Option 1. Age. Option 2. Gender. Option 3. Smoking. Option 4. Family history. The answer is option 3. Smoking. Which type of cholesterol is known as Good cholesterol. Option 1. Low density lipoprotein, LDL. Option 2. Very low density lipoprotein, VLDL. Option 3. High density lipoprotein, HDL. Option 4. Triglycerides. The answer is option 3. High density lipoprotein, HDL. Which of the following is a non-modifiable risk factor for CAD? Option 1. Smoking. Option 2. Obesity. Option 3. Age. Option 4. Hypertension. The answer is option 3. Age. What is the primary goal of CAD management? Option 1. Prevent heart failure. Option 2. Reduce cholesterol levels. Option 3. Improve blood flow to the heart. Option 4. Reduce blood pressure. The answer is option 3. Improve blood flow to the heart. Which procedure involves using a balloon to open up narrowed coronary arteries? Option 1. Coronary artery bypass grafting, CABG. Option 2. Angioplasty. Option 3. Echocardiogram. Option 4. Stress test. The answer is option 2. Angioplasty. Which is a common complication of untreated CAD? Option 1. Arrhythmias. Option 2. Heart attack. Option 3. Heart failure. Option 4. All of the above. The answer is option 4. All of the above. What type of angina is relieved by rest or nitroglycerin? Option 1. Stable angina. Option 2. Unstable angina. Option 3. Variant angina. Option 4. Microvascular angina. The answer is option 1. Stable angina. Which imaging technique is used to assess heart function in CAD? Option 1. X-ray. Option 2. Echocardiogram. Option 3. MRI. Option 4. CT scan. The answer is option 2. Echocardiogram. Which blood test is used to assess inflammation in CAD? Option 1. Troponin. Option 2. C-reactive protein, CRP. Option 3. Lipid profile. Option 4. Complete blood count. The answer is option 2. C-reactive protein, CRP. Which class of drugs is most commonly prescribed to lower cholesterol in CAD patients? Option 1. Beta blockers. Option 2. Statins. Option 3. ACE inhibitors. Option 4. Diuretics. The answer is option 2. Statins. What is the main cause of myocardial infarction? Option 1. Coronary artery spasm. Option 2. Plaque rupture and thrombosis. Option 3. High blood pressure. Option 4. Infection. The answer is option 2. Plaque rupture and thrombosis. Which symptom is least likely to be associated with myocardial infarction? Option 1. Chest pain. Option 2. Shortness of breath. Option 3. Abdominal pain. Option 4. Headache. The answer is option 4, headache. Which test measures the heart's response to physical stress? Option 1, echocardiogram. Option 2, stress test. Option 3, CT angiography. Option 4, electrocardiogram, ECG. The answer is option 2, stress test. What is the role of beta blockers in CAD management? Option 1, reduce heart rate and blood pressure. Option 2, increase blood flow to the brain. Option 3, enhance heart contractions. Option 4, reduce cholesterol level. The answer is option 1, reduce heart rate and blood pressure. What is a common symptom of silent myocardial infarction? Option 1, chest pain. Option 2, fatigue. Option 3, severe headache. Option 4, shortness of breath. The answer is option 2, fatigue. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. What is the primary difference between systolic and diastolic heart failure? Option 1. Systolic failure involves impaired contraction, while diastolic failure involves impaired relaxation. Option 2. Systolic failure involves impaired relaxation, while diastolic failure involves impaired contraction. Option 3. Both have the same mechanism of failure. Option 4. Neither involves impaired contraction or relaxation. The answer is option 1. Systolic failure involves impaired contraction, while diastolic failure involves impaired relaxation. Which of the following is a key feature of congestive heart failure? Option 1. Elevated blood pressure. Option 2. Fluid retention and edema. Option 3. Chest pain. Option 4. Fever. The answer is option 2. Fluid retention and edema. Which condition is the most common cause of heart failure? Option 1. Hypertension. Option 2. Myocardial infarction. Option 3. Diabetes. Option 4. Valve diseases. The answer is option 2. Myocardial infarction. What symptom is commonly associated with left-sided heart failure? Option 1. Peripheral edema. Option 2. Pulmonary congestion. Option 3. Weight loss. Option 4. Jaundice. The answer is option 2. Pulmonary congestion. Which of the following is not a symptom of heart failure? Option 1. Shortness of breath. Option 2. Fatigue. Option 3. Tachycardia. Option 4. High fever. The answer is option 4. High fever. What is the ejection fraction threshold for diagnosing systolic heart failure? Option 1. Less than 50%. Option 2. Less than 40%. Option 3. Less than 60%. Option 4. Less than 30%. The answer is option 2. Less than 40%. Which diagnostic test is most commonly used to assess heart failure? Option 1. Electrocardiogram, ECG. Option 2. Echocardiogram. Option 3. Chest X-ray. Option 4. Blood pressure monitoring. The answer is option 2. Echocardiogram, which is a hallmark sign of right-sided heart failure. Option 1. Pulmonary edema. Option 2. Peripheral edema. Option 3. Elevated blood pressure. Option 4. Chest pain. The answer is option 2. Peripheral edema. Which peptide is elevated in heart failure? Option 1. Troponin. Option 2. Brain natriuretic peptide, BNP. Option 3. C-reactive protein, CRP. Option 4. Albumin. The answer is option 2. Brain natriuretic peptide, BNP. Which medication is commonly prescribed to reduce fluid retention in heart failure patients? Option 1. ACE inhibitors. Option 2. Diuretics. Option 3. Beta blockers. Option 4. Statins. The answer is option 2. Diuretics. Which of the following is a first-line treatment for heart failure? Option 1. Calcium channel blockers. Option 2. ACE inhibitors. Option 3. Anticoagulants. Option 4. Statins. The answer is option 2. ACE inhibitors. Which of the following is a common cause of diastolic heart failure? Option 1. Coronary artery disease. Option 2. Left ventricular hypertrophy. Option 3. Atrial fibrillation. Option 4. Endocarditis. The answer is option 2. Left ventricular hypertrophy. What lifestyle modification is most effective for managing heart failure? Option 1. Reducing carbohydrate intake. Option 2. Reducing sodium intake. Option 3. Avoiding protein. Option 4. Increasing fat intake. The answer is option 2. Reducing sodium intake. What does the New York Heart Association (NYHA) classification assess? Option 1. Heart anatomy. Option 2. Heart failure symptoms. Option 3. Ejection fraction. Option 4. Electrolyte balance. The answer is option 2. Heart failure symptoms. Which is the most likely symptom of advanced heart failure? Option 1. Tachycardia. Option 2. Orthopnea. Option 3. Nausea. Option 4. Chest pain. The answer is option 2. Orthopnea. Which is the purpose of beta blockers in heart failure treatment? Option 1. Increase heart rate. Option 2. Decrease oxygen demand and improve survival. Option 3. Remove excess fluid. Option 4. Enhance ejection fraction. The answer is option 2. Decrease oxygen demand and improve survival. Which is a common complication of untreated heart failure? Option 1. Arrhythmias. Option 2. Liver cirrhosis. Option 3. Kidney stones. Option 4. Pneumonia. The answer is option 1. Arrhythmias. Which of the following describes systolic heart failure? Option 1. The heart cannot relax properly. Option 2. The heart cannot pump blood effectively. Option 3. The heart valves do not close completely. Option 4. The heart rhythm is irregular. The answer is option 2. The heart cannot pump blood effectively. What does pulmonary congestion indicate in heart failure? Option 1. Left-sided heart failure. Option 2. Right-sided heart failure. Option 3. Systolic heart failure. Option 4. Diastolic heart failure. The answer is option 1. Left-sided heart failure. Which dietary restriction is most important for heart failure patients? Option 1. Low protein. Option 2. Low carbohydrate. Option 3. Low sodium. Option 4. Low fat. The answer is option 3. Low sodium. Which device is often implanted to prevent sudden cardiac death in heart failure? Option 1. Pacemaker. Option 2. Implantable cardioverter defibrillator. ICD. Option 3. Left ventricular assist device. LVAD. Option 4. Stent. The answer is option 2. Implantable cardioverter defibrillator, ICD. Which medication class improves survival in heart failure patients? Option 1. Calcium channel blockers. Option 2. ACE inhibitors. Option 3. Diuretics. Option 4. Anticoagulants. The answer is option 2. ACE inhibitors. What is the target ejection fraction after treatment in systolic heart failure? Option 1. Greater than 30%. Option 2. Greater than 40%. Option 3. Greater than 50%. Option 4. Greater than 60%. The answer is option 2. Greater than 40%. Which symptom suggests worsening heart failure? Option 1. Weight gain due to fluid retention. Option 2. Increased energy levels. Option 3. Improved breathing. Option 4. Lower blood pressure. The answer is option 1. Weight gain due to fluid retention. What is the prognosis for untreated heart failure? Option 1. Good. Option 2. Poor. Option 3. Varies with age. Option 4. No effect on survival. The answer is option 2. Poor. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.